Well, good morning, everybody, or good afternoon, depending on where you are in the country. My name is Garrett Schmidt, and I'm the CEO and managing editor for BBC Exhibit Hall. And I'd like to welcome you all to today's live webinar hosted by Bridge, and it is called A Payer's Pathway to an Integrated Fraud to Waste and Abuse Program, which is a very important topic, one that's often overlooked. And so I think there's going to be a lot of great, in fact, I know there is because I saw a preview of it, a lot of great information exchanged today, so definitely glad that you joined us today. A few items of note before we get started. This is a traditional webinar format, so everyone has joined us today in listen-only mode, so you don't need to worry about turning off your camera or your microphone or anything like that. That's been done for you. So we can't see you or hear you, but we do want to hear from you. And so we're going to have a time for some Q&A towards the end of the presentation. So if you have a question for either of our speakers that I will introduce in a moment, you can drop that into your attendee module at any time using your little module there. There's a place for questions, so go ahead and drop your questions in there. We're going to get to as many as we can in the time allotted. If for some reason we don't get to yours, don't worry. Someone will reach out via email afterwards to make sure we answer your question. Also, today's session is being recorded, so you will receive an email when we're finished, maybe about an hour or so after we're done, and there'll be a link to the recording as well as to the slides so that you can download, and this way you can review the information, you can share it with colleagues and friends, and we hope that you do. So without further ado, wanted to introduce our speakers today. With us we have Miss Amanda Brown, and she is the VP of Revenue Integrity with Bridge. We also have Mr. Ray Evans, VP of Healthcare Sales. So welcome, you two.
Thank you.
Thank you.
All right, I will turn it over to you to begin.
Great. Well, I will start by introducing myself, Amanda Brown. I have over 20 years of health plan experience, many roles in executive leadership as a compliance officer for health plans, as well as running special investigations units and working in healthcare operations, audit, and compliance. So just to start off on what we'll cover today, as many of you may already know and probably do know, fraud, waste, and abuse costs our healthcare systems and payers billions of dollars every year, which is passed on to our at the end recipient of health plan coverage in premiums and shared costs with the plans, which negatively impacts operational efficiencies. So today we'll be talking us through the essential steps in creating an integrated fraud, waste, and abuse program at your plans and empowering your plan to detect, prevent, and effectively combat the issues that you may face with fraud, waste, and abuse within your organization. So to start off, we wanted to get an idea with a polling question. So I will turn this back over to have you all answer a polling question. This gives us an idea of, how our plans are structured or how your plans are structured.
All right, so we just pulled this question up on your screen so you guys can all play from home. And just as a reminder, this is anonymous, so we will not be sharing these results, but we're going to show you the percentages here, so you'll be able to see where you stack among your colleagues. But you can go ahead and answer honestly and accurately, because again, these are anonymous answers. And we're going to give just a couple more seconds for the results to come in. So again, the question is, who oversees the SIU and FWA programs within your organization? Is it compliance? Is it legal? Is it finance and accounting, operations, clinical operations, or other? And this is a select all that apply, by the way. So if it's more than one of those, that is okay. And we're going to have a couple more polling questions as well. Keep you on your toes before we conclude for today. So we've still got some results coming in, so we'll give it about 10 more seconds and we will close it down. In about 5, 4, 3, 2, and 1, and I'm going to go ahead and share the results. Okay, Amanda, you may not be able to see it on your end, But Ray, you should be able to see the results. So we've got 75% compliance, 5% legal, 0 for finance and accounting, 0 for clinical and operations, and 20% for other.
Great.
Yeah,
Well, I will
those are
say
interesting
I'm a
numbers
little,
for sure.
yeah, I'm a little surprised there isn't any in finance and accounting. That sometimes trickles into that a little bit, but the compliance and legal areas are the most common areas, but we are seeing some shift within organizations as cost of care oversight becomes much more important and overseen much more by the board and the executive leadership. So most of the time those others are some sort of support organization or areas of cost of care or cost of care oversight. Great. Well, thank you for sharing that. That's helpful to understand as we talk through in how fraud, waste, and abuse and the opportunities that are out there and the things that plans should be looking at, and how it really gives me an idea of who is on the call and how that impacts you as in your organization. So let's get to know a little bit about Covent Bridge. So Covent Bridge has been in the industry as a UPIC vendor for CMS for over 24 years, or coming up on 25 years. We're a global leader in full service investigations. And so we got our start in property and casualty investigations with investigators conducting investigations on site and desk audits in that environment. And then almost 25 years ago, added a service line to support the Medicare fee-for-service business and other areas of business that the government works in as well. We have a contract as a USDA and SNAP contractor doing investigations there. And like I said, a program integrity investigator for CMS. And then we have various fraud units and staff across the country where we conducted over 100 investigations over 100 countries last year as well. And also to support all of this, in the United States, we have a little over 700 employed investigators that are licensed in the states where that is required, and providing on-the-ground support to our health plan partners and our government partners in conducting investigations, surveillance, canvassing, validating that a provider is actually in the office or not, or are there staff in those offices, or is there just one car that happens to be the billing person that's sitting there submitting bills and claims to the health plans. So we have a national network of investigators with extensive experience in law enforcement backgrounds, investigations backgrounds, as I said, licensed as an independent investigator in the required states.
And a lot of those folks
Anything
that
you
are
want to add to that, Ray?
Yeah, a lot of those investigators are former OIG, DOJ, FBI, military, law enforcement, private investigators, and all the investigators will be licensed in the states that they do work in, so that you make sure you get your bases covered there.
And they also understand, being that they're strategically located, understand the norms and the environment of the local market, which is important as well. So this opens us up into our next polling question. So I will turn that over so that we can give you an opportunity to answer our polling question. And that's, how confident are you in your organization's ability to predict new fraud schemes before they cause significant losses?
Okay, and it is already up on your screen, and I see a bunch of you are already answering, taking it off. So let's see, we've got very confident, somewhat confident, neutral, or not confident at all. And looks like we've got a good mix here coming in, which we will show here in a moment. But I'll give you all a few more seconds to answer here. And again, how confident are you in your organization's ability to predict fraud schemes before they cause significant losses? And they will. All right. I think most folks have answered by this point, so I'm going to go ahead and close it down in 5, 4, 3, 2, and 1, and we will share the results. Okay, so we have 6% of you that said very confident. 29% said somewhat confident. About 47% of you said neutral. And 18% said not confident.
Not surprising.
That's a great mix. Yeah. Yeah, great mix there. And I think the neutrals are probably, I feel pretty okay, but there's some days that you probably feel good about it, and then other days you may not. And I think that's a great mix. And so thank you for that. So when we think about all the elements of a comprehensive fraud, waste, and abuse program, you'll see these checking off here. Each of these items play an integral part of a successful SIU program. And on top of this, as you all know, you have all this work to do. And then on top of that, you have competing priority, you name it. The list goes on and on of the priority lists. And for those of you that may be a health system or a payvider, many of these are, integrated maybe a little bit differently than a direct health plan because you have the health system, but the expectations are still the same of managing fraud, waste, and abuse in your claims and the submissions of potential inappropriate billing. So with all that said, how do you get to and manage all of that? And so that's where services like we provide here at Covent Bridge work with our clients on all of these elements. And they can really be summarized into these seven major categories and how we help our clients. And the great thing is we're an agile organization where we're not a one-size-fits-all. We understand that there are groups out there that it's these solo compliance / SIU investigators / potentially even legal counsel. I've been there, done that. Been the solo compliance officer managing these until I could really get my feet on the ground and begin building a program. And so understand that they have that all the way to the larger health plans that have many, many resources that may just need some support in certain specific areas. And so we're able to meet our clients where they are and integrate into your programs depending on your needs and your resources and support. And so we have a program and a model where we have analytics, software, and sampling of looking at claims, whether those are submitted by a health system or a payvider, or the claims that were received by a health plan, and doing analysis on those to look for outliers, trends, issues, and we risk score that all the way through to identify any potential risks and provide you the opportunity to take a look at any issues that pop up that have a higher risk score versus something that's much smaller. And then taking that information and putting that into a case management platform where really you can see really in a visual form what your analytics outputs are, but then also manage those cases and prioritize leads, corroborate any potential findings, or nullify them to say, we looked at this and we investigated this, we've dug in, we flipped the hood a little bit, and maybe there wasn't an issue. The system also allows medical record review, case review, documentation, any potential investigations, investigation notes, and copies of documents, recordings, images, any of that can be there. And then also managing then to the next of the recommendation and remediation, claims prepayment or post-payment, or taking action on any claims that may be there. For those that have submitted a claim, if there's an issue that you find that may have already been submitted to a payer, the ability to disclose that information and work with the payer on any potential remediation as well. It's always better to notify and work through that process then for a payer, or on the government side from a health plan perspective, those claims or those issues to be found through an audit. We also help with law enforcement referrals. If our investigators are helping, we can help with the court case and other interviews and those kind of things, and make sure that your system has all the documentation that's necessary. And then all of that information through this whole process is then fed back into the analytics platform to continue to educate the analytics models and the opportunities that are there and the risks that you have. And really, through that whole process, we're collaborating with the plan or the system throughout this process to support your services as well. Anything you want to add to that, Ray?
Well, yeah, and I think one thing that's important to note, we completely understand, and every health plan operates differently, right? When you've seen one health plan, how they do things, you've only seen one health plan, right? I think we can agree on that. But the one thing that I think is overwhelming commonality is that we understand that your provider networks, if you're a health plan, your provider networks are your lifeblood of your organization. So to Amanda's point, if we are working with a health plan and working on these leads and cases, we will consult with you all along the way, and we will only do as much or as little as your organization wants us to. Okay, so it's not like we're looking forward to finding somebody doing something bad. That's not the point. We're there to help you and help your teams, and then protect your organization from a compliance and a financial standpoint.
Absolutely. Okay, so challenges to the process and what many plans and fraud, waste, and abuse programs struggle with. And that's number one, first and foremost, data, right? The amount of data, the siloed data. And so, when looking at data silos, and how you can work through to get to the point where you can really take your data and bring it out to find these potential scams, is to implement a data integration strategy to consolidate information from multiple sources. That means your claims data, your provider data, providers that are credentialed, pharmacy data, any vendor data that may be there of any carved out services, as well. In our system, we bring in information around data that this tax data, purchasing data. So if there are assets that were purchased, we can see that and overlay that into the data to identify any potential drivers of risk or potential fraud, waste, and abuse. Working through the volume of data, the sheer amount of data is overwhelming today. And so utilizing an advanced technology like AI or machine learning and automation to handle the large sets of data is something that we specialize in here to help our clients manage through that and break down that siloed data, but also manage the significant amount of claims that are there and the provider data as well. Working through data quality issues. We cleanse data. We'll work with teams to cleanse the data and validate and ensure accuracy and reliability. One area that I think plans sometimes struggle or forget about is their vendors, your vendors, or anyone that's a delegated entity. Don't forget to audit them or collaborate on data dictionaries to ensure that when you're trying to bring that data in, there's some consistency around what field means what, and so the integration is able and can be managed on the front end and not a catch up on the back end. And so we can help our clients work through that as well. And then evolving fraud schemes. These schemes are constantly evolving. So combining the data-driven insights with human expertise and then the behavior analysis really helps to detect new and complex schemes as they're emerging, or even predicting those potential schemes before they happen. Many plans lack the contextual information. This is the holistic approach of integrating, the external factors, as I said, those economic things, the purchases that may happen, tax records and such, but also social or geographic information. And that's where many of our on-site local investigators can provide some of that contextual information, because sitting behind a desk isn't always going to give you that insight around the qualitative field investigation work and insight there. And then cross-collaboration, and that's fostering partnerships and collaboration between health plans and the enforcement and the regulatory bodies, but also integrating and sharing that information internally so that you can improve intelligence, but also collaborate within the organization to prevent future issues. Another area where plans and systems can also collaborate, and many don't think to reach out, but that's to reach out to your state and local government agencies that are combating fraud, waste, and abuse, as well as your competitors in the area. It never hurts to pick up the phone to say, hey, we're seeing a claim spike in this, or we're seeing a trend in this, that, or the other. Are you seeing that as well? You may find that providers go to a training session, and many of the providers in the area went to that training session, or one or two, and they shared that information with their peers. And so you see a spike or an issue or a trend in an area that maybe it's not fraud, but maybe it's wasteful or abusive, to increase revenue. But maybe the impact of that increased revenue could have a negative impact on quality or even potential risk of harm.
Amanda,
So
let me add,
sorry, go ahead.
yeah, let me add to that. One thing that we have a great relationship with several inspector generals across the jurisdiction that we primarily work in. And the feedback that they've given me was they would love for health plans or provider groups or whoever to reach out to them. If you feel you have something or you're concerned about something, they would love to have more folks reach out to them. That they don't get too many, but when they do, they really appreciate it. It helps their jobs to be a little bit easier, and it gives them insight as to what's going on within their state. So they greatly appreciate that. So, I know a lot of folks may be hesitant to reach out to, an inspector general of a state. I can tell you from personal experience, they're very great people and you shouldn't be afraid of them. As a matter of fact, we have one of them that's going to be presenting with us at some conferences here in the coming months. So they really, really appreciate all the feedback that they can get from you guys there in their states, just to point that out.
Yeah, and I think also reaching out to your U.S. attorney's offices in your local region. I know I sit here in Kansas City, and there is a work group around fraud, waste, and abuse where health plans come together and other entities come together with CMS, OIG, railroad, postal inspectors, and come and talk about schemes or issues or trends that may be starting to pop up, or that they may be working through or have just worked through. And so it would be worth reaching out to your U.S. Attorney office at your federal courthouses locally and see if they have any of those types of fraud, waste, and abuse and work groups that could potentially provide you some education and feedback. And they even do that in other areas as well, around security and other things. So it's always interesting to find out what may be there at your federal level that you may just not be tapped into or aware that's out there. And if they don't, knowing or hearing from you that you're interested in something like that in your area where they may not have it today, may be the opportunity to push that going forward. So, like we talked about, you have all this data, and so how do you manage through that? And that's where we can help our clients, and have helped our clients bring in into a single repository all of this information. The data overload of all of your records, your documents, your images, your reports, all of that into one single repository of bringing in medical records and other information in to be able to identify potential schemes, issues, and extract any of those potential risks in one single source system that also can then manage and inform investigations going forward. And that includes the initial upfront, like I said earlier, all the way through to the investigator's notes, clinical review and looking at medical necessity and bumping medical necessity criteria against claims records. All that can happen within that one system where we can pull all of this information in to inform those pieces. And then on the back end, have a system of a record that then can be utilized, whether it's just taking action internally against a provider or different staff. If you're at a system, if you're at the health or at the health plan side, the system of record of doing any sort of recoupments or prepay, and then ultimately, if there's some fraud identified, having a court-ready case available to send to your legal team as well. And so we have data scientists and data teams that work through this with your teams to really us be the worker bees, and your team just be the advisory as we work through to bring all this data together. So all of this is there. And then when you bring all of this together and integrate all of this information, what are the tools and techniques that we utilize and or plans or systems should be looking at to utilize to identify potential fraud, waste, and abuse? And there's multiple out there. And so I thought I would share with you some of the most common of these tools and techniques and walk through those. So data mining and pattern recognition, this is where we can pull in that historical claims data to inform the analytic models to identify outliers within the particular peer group. And so it's not just, well, you have the top 10 most claims submitted as a cardiologist, so compared to all of our network. So therefore, you must, be potentially fraud, waste, and abuse. That's not how, these systems with data mining and pattern recognition, if they're informed correctly, will work. It would be taking that provider and bumping it against that peer group of providers, and then with the informed piece of that to say, oh, but this is only the cardiologist, the only cardiologist within a 50-mile radius, therefore this would be expected that you would have a higher volume. And so it informs that decision better to identify better leads around fraud, waste, and abuse. Automated claims review, so consolidating the data from multiple sources in claims review. And that would be your historical claims, any future claims, but then also looking at any denied claims, recouped claims, appeals and files as well, and bringing all that together to really get an informed view of what has been happening in your claims review. Data integration, and this is around consolidating data from multiple sources to gain a full review of your fraud, waste, and abuse program, and that's really just bringing that all together. AI, AI and machine learning. AI is the big hot topic, buzzword out there today, but artificial intelligence really needs to be informed. And so that is an integration of machine learning. We hear these examples out there in the news and such that, or just playing, if any of you have played around with artificial intelligence. I was just at a conference where people were doing that, and they were playing with the artificial intelligence and asking it, tell me, what billing codes can you put together for this, that, and the other, and it spit out, this very formulaic piece. But that doesn't mean it's actually accurate. And then they tried another AI tool, and it was like, sorry, I don't understand the complexity of your question. And so it's only going off of what it knows. And so machine learning, where there's a data scientist sitting behind that to really inform that through machine learning and adapting and adjusting those fraud tactics is really key. Link analysis. Our system provides link analysis around relationships of providers, members. Do you have a member sharing process or system or issue or scheme happening behind the scenes where providers are sharing members? I've investigated cases that have been prosecuted and people are sitting in jail today because of patient sharing and different schemes that are out there, and cycling patients from one facility to a next. And so the collusion and those relationships and networks and identifying that is very important. And then the geospatial analysis. This is those geographic anomalies for billing of services. This is, like I said earlier, around a provider being the only provider in a 50-mile radius, or maybe it's the only PEDS provider that sees this type of service. We can inform our analytics with plan-specific information, or your provider group or health systems information to inform the analytics system to then set those different factors aside if they're identified, to really get down to what truly is potential fraud, waste, or abuse. Anything you want to add to that, Ray, before we jump to our next polling question?
Yeah, actually, so and I just wanted to point out, as she was saying, to give some specificity to, like, the data that can be collected is massive, not just your claims data or that type of thing. Where what we basically do is we take into account your supplemental data. We get additional data from Clear and LexisNexis, and we've got a bunch of those sources to gather. It would be mind-blowing to you if you really knew exactly how much data those organizations have. And that helps within our analytics and our algorithms to be able to take into account and identify, doing medical canvassing and all of that type of stuff is really important to identifying, hidden types of patterns or schemes that could potentially be out there. They're not going to jump out at you. You've got to search for them. These people are really smart. And a lot of them use AI to combat against us. So we have to arm us and you as a client with as much information as possible to be able to find these bad actors, right? So that's all I had.
Yep. Okay, so we will open this up to our third polling question. So we'll turn it over to start that. So what's your biggest challenge with data integration for fraud detection? And so this is your biggest challenge. So just choose one.
Okay, so it is up on your screen right now. And again, What is your biggest challenge with data integration for fraud detection? Is it siloed data systems, lack of governance policies, incomplete or low quality data, or limited resources due to process and analyze data? You may be thinking, oh gosh, there's a little bit of all of these, but if you had to choose one, which one would it be? We're going to give about another few seconds to get all the results in here, and then we will show you the results so you can see where you stack among your colleagues. Again, as I always say, this is anonymous, so feel free to answer accurately. And we'll wrap it up here in about 10 seconds. In about 5, 4, 3, 2, and 1. And I'm going to go ahead and pull up the results here. Okay, so siloed data systems came in at 29%. A lack of governance policies was 0. Good job. Incomplete or low quality data is at 12%. And then the majority of you said limited resources due to process and analyze data. That's at 59%.
Yeah. And that's not surprising. That's what we hear the most from our clients is, I have all the data. I'd love to give it to you, but we don't have the resources to get the data to you, to really process it into your system and make sure that it spits out the right thing. And so not surprising by that piece. And that's why we've tried to have an agile program and process to really be able to take in that data for our clients from those siloed data systems, which was the other 29%, from those siloed data systems, as well then to really take the lead in processing and analyzing the data. So we can take them from multiple sources, whether it's claims files or EDI files or different types of files, and be able to normalize that data with our data science team to then analyze and insert that data into the system and then analyze that data for potential risks of fraud, waste, and abuse. So not surprised, but we have seen some of that changing as plans and groups have begun to really invest in some of that, the data teams. But then it still is struggled when you have the siloed data systems. Okay, so now we've talked about all of this analytics and what an integrated analytics process looks like, and we're bringing all of the data together. And so what can you do with that data? So this is our Smart Partner platform, and there are services out there that provide analytics, but this is our integrated analytics program that takes all of that analytics and integrates that into also the case management program or platform like we talked about. But this is the front end of that. So this is showing you that, once we get all of that information in, we can then look at different provider alerts and reports that are there to then inform your investigations process into where do you really need to take a look and dig through. And so you'll see here we have risk scores of different providers and dollars at risk. So you have a number of claims that are here and maybe there's a look of the claims count. There's 156 leads out of that, or different data points within that, with 184 members that are impacted with a risk, dollars at risk of. This is an example of $657,000 or $657 million for particular services. And the great thing about what we can do with this is then take this and the analytics of this and how those are risk scored, and then begin to look into what providers may be connected, what members may be connected, and then kick off an investigation. As you can see here, you can go through and actively start an investigation or filter and drill down into any one of these items that you see on the screen here. Anything you want to add to that, Ray, around analytics and bringing that into the system?
Yeah, I mean, a lot of folks, the feedback that we've gotten is that especially health plans, right? And I know there's probably some folks on here from other types of organizations, but when I speak to health plans, the feedback from them is, okay, well, we contract with so and so to do the analytics, right? And then they get the analytics, and then they're like, okay, now what? They're not really sure. It doesn't display in such a manner that is understandable and actionable, right, to your SIU teams. And that's what this platform basically does. It helps with that. So it leads you to what is the next step. And, we work with your teams as well to discuss, what are the recommendations? Is it something you really need to focus on, or is it not? And that speaks back to the risk scores that we do for each individual potential lead or case, which goes back to it, which is tied to a particular provider or providers, right? So, but that's a lot of the feedback we get from plans.
And we also have the agility that if you have a current analytics platform today that you're using, we can feed that information in to the system. Or if you have a data analysis team, we can still feed that information and the output into the system so you can manage your cases, have a secure record on that, have monitor and manage all of your processes and platform and program within this one integrated system as well. So next, we're going to talk about scheme predicting. So we have all this information brought together, and in the analytics of this, we have multiple scenarios and multiple processes. And we've talked about some of these a little bit before, but want to dive into these a little bit more. Into what an integrated analytics program should be doing for you, or things you should be looking for when looking for an analytics platform. So predictive modeling, that's identifying, potential fraud hotspots, high-risk providers and members, and based on past history and past performance. And so having a system like what you saw there, all of that would be pulled forward and integrated into that risk score that you saw. Behavioral analysis, that's identifying deviations from the norm. This would be provider or patient behavior. So monitoring and managing and predicting any changes that may happen around the claims and identifying those claims and those behaviors that could potentially identify issues before they start. Then the scenario simulation. We, behind the scenes, test the likelihood of different scenarios, as well as identify potentials to where we can refine and educate the system to test the likelihood of an upcoding or phantom billing or prescription abuse. And some of this is in if you have a new regulation coming through, or a change in a claim, a way a claim will be paid, or different guidance that CMS or other regulatory bodies would put out, we can then run a scheme ahead of time to say, okay, if this scenario happens, what are the particular risks that may be there in these billing patterns that could identify or spike and become an issue around fraud, waste, and abuse in those particular scenarios. Machine learning, as we talked about before, evolving and emerging those schemes, changing industry trends or industry regulatory processes, and teaching the analytics to improve and monitor and adjust based on those. The system, having a system that does real-time alerts, early warning around fraudulent claims, or prior to paying a claim, or even submitting a claim, and identifying those prepay reviews ahead of time. And then preventable actions. These would be taking all of the information that you receive and then tightening the claims reviews protocols, really having that feedback loop into your analytics system so that you can revise reimbursement policies, do provider education, but also inform your claims edits and other preventions that you may have into your systems to prevent potential fraud, waste, and abuse. So bringing all this together into one system with an integrated analytics into case management, monitoring the investigation, and then bringing forward those efficiencies and results. And so, having an integrated and automated system provides faster identification of fraud, reduces manual review time, and then quicker responses to potential fraud, waste, and abuse issues. Integrating the fraud, waste, and abuse management, fraud, waste, and abuse cases into a case management platform that's integrated really provides the seamless FWA management. It reduces those inefficiencies and minimizes the potential of undetected fraud, waste, and abuse as well by not having siloed systems and siloed processes, which then leads to interdepartmental collaboration. And enhances the communication, whether that's through your network team, your claims team, to really monitor and manage those communications and shared information for quicker resolution of cases and reducing duplicative efforts. Many times we find that there's a special investigations unit that is conducting investigations or desk audits for potential fraud, waste, and abuse, but then you have a claims integrity team that's looking at, did the claim pay right, did we overpay it, and just really looking for overpayments. And many times those departments are doing much of the same. And so a true FWA program that would inform some of those efforts of both of those departments, but really giving the opportunity to take your FWA investigations to the next level to really dig into potential fraud, waste, or abuse from the Special Investigations Unit side or the FWA team. Then that leads to continuous monitoring and reporting, measuring measurable improvements in fraud detection rates, having a system that can provide a view of your return on investment and fraud detection rates, and monitoring and oversight of that will help to inform the decisions you make as a team, but also reduce your financial losses and then have better compliance outcomes as well. And last but not least, third-party oversight and collaboration, making sure that you have a program to oversee your third parties that that feed into your financial systems, your claims, to reduce the risks from those sources and improve operational controls and put edits and operational processes in place to prevent issues as well. So having all of this information brought into one place really informs each of these processes and provides the operational efficiencies and results that we've continued to see of our clients in their recoveries and preventions of dollars going out the door. Anything you want to add to that, Ray?
I'm good.
Okay, so what does that really look like within the system? So as you can see here, this is on the investigations tab. So the great thing about an integrated system is you bring forward the analytics like we talked about before, and you open an investigation, and then you have the investigations section where you can see at any point in the process where the investigation is. And so this is the medical necessity portion. So as you can see from this, you can see the case summary and the case notes of the investigator or any investigations notes. The summary of the findings are there, and you have those key actions and dates listed. So you can see at any moment what was the last action taken, what was that key action, and then just a very high-level summary of what is taking place. So all the medical records have been received and medical review has started. And so you can look to see at any point where that case is and drill down on each of these items so that you can identify and report on where cases are against dollars at risk and where those providers may be falling on that risk score. And you'll see the investigative milestones. So you can see in here, you've got the lead is already completed and the investigation is completed of anything on site that may have taken place, or any interviews of members or patients or other providers or facility staff. Any of that has already taken place, and now conducting a claims review against the medical records. And then that feeds into the investigative medical review reporting process. So, and the finalization of that medical review. So if we, as Covenant Bridge, were to assist in this process, we have clinical reviewers employed, multiple, over 100 medical claims nurses and RNs and medical directors sitting behind the scenes as employed staff to review these claims against the medical necessity criteria that may be applied by your plan or by your facility, and bump that information up against what the medical records have, and then make a decision around would that be a deny and the reason for denial, and should there be any paid amount and any additional narrative that may be there. And then the great thing is there is a quality improvement or a Q&A process around, or QA process around this to ensure that if we were to do it, or even an employee of your group doing the investigation were to make that decision, there's a final sign-off either by you as the plan or facility, or by the management team to say, yes, we accept this, or no, we don't, and any rationale to agree or disagree with the decision, so that you have a quality oversight process built within the system to manage any denials. As we know, denying a claim or clawing back claim dollars has implications. And so we want to make sure that there's a way to validate the findings and have an agreement. And then taking that into oversight management. So as the leader in the department looking at any of these cases, at any point you can pull up the dashboard and look at how many claims are in review and what types of claims are in review. So are they SNF inpatient? Are they pharmacy? Are they DME? Are they behavioral health claims? And this can be adapted to the type of services that are in your claims, right? So this would be not just canned items here. And then anything that's unassigned, that hasn't been assigned for review, and just kind of different views that you can have by that. Claims by reviewers. So, you know, depending on how many staff you have here, or if you have one or two internal staff, but then you have a team behind you of Covenant Bridge staff helping support your process, those would all those reviewers would be listed here. And at any point you can see what that caseload is so that you can adjust and spread the wealth, but also know where different cases are. And then you can drill down into the claims detail and figure out exactly where it is, who the reviewer is, and how complete they are with any review or documentation into that process. So a full dashboard that can give you really great insight into your performance and monitoring your work on hand, and be able to report that into any executive dashboards, or use this as an executive dashboard summary to really inform the conversation in meetings. And staff oversight. And then the beloved reporting and documentation requirements. So having a system that can help you with each of these items from, the regulatory compliance to documentation of the comprehensive investigation for any potential law enforcement referrals. But even if it doesn't go to that level, just having that for any conversations that you may be having for, having a conversation with the provider, provider education, and some of those each one of those actions will be documented in that. And then if you do provider education and it becomes a consistent issue, and corrective actions aren't monitored and managed and corrected, then it may turn into a law enforcement. But each one of those steps, the detailed documentation is there and locked and safe, with all of the detail behind it supporting that. We have, as you may have saw at the very beginning, we are we are a federal contractor, so we meet all of the DoD standards and CMS's standards around data privacy and security. And you want to find a vendor, as we all know, there's a big name out there that had a huge breach that kind of put the industry in a tailspin for a bit. And so making sure that you have a system that is really safeguarded against privacy and security issues, having a system that can give you an audit-ready state. It will help minimize your risks and demonstrate your compliance to the industry and to your regulators and to your leadership team. Internal reporting and processes. This is, like I talked about before, having dashboards to monitor and oversee the investigations and response to those FWA potential investigations and any potential schemes, and showing your impact into the program is important. And then if you have to do reporting to regulatory agencies, having the system capability to report on cases at case level or whatever may need to be required to a Medicaid agency, CMS, or any other regulatory agency, having that ability right at your fingertips is really important. So from a reporting, just to give you a kind of a view of what that looks like, there's multiple dashboards in our system, and you should look for a system that has dashboards that can provide you performance metrics, and what do you have dollars at risk, and what's on prepay, and how many providers are you looking at, and how many claims are involved, and what's your days on hand, and how many open leads and there are in process, and the different areas or different actions that may be taken, and what is taking place in each one of those cases, and that you can refer to quickly so that you can see in a really easy visual format where your program is performing and how you're performing against the metrics. And you can also see dashboards around what are your common allegations. Many times I would get asked by leadership, what are you seeing, right? Or my medical director would say, what are you seeing? I'm feeling like I'm seeing this, that, or the other. But then I go and I pull up the report, and that's not what's really taking place there at all. It happens to be, DME, or it happens to be a specific procedure where we're having most of the flags come up. So it helps inform the internal leadership as well. So I get asked, I was a consultant prior to coming to Covent Bridge to many executive compliance leaders of all shapes and sizes across the country, and have also sat in the seat as a compliance officer and had to answer the same question, which is like, great, I know we have fraud, waste, and abuse, right? We all know what it is, right? But so, what's the impact, and why should I care? And why should I, as a leader, or what can I say to my leaders to give the reasoning and the support, and get the support and the budget to take steps to identify a fraud, waste, and abuse analytics and case management platform and support. And the impact of the health plan is obviously the increased operational costs of manual processes and non-integrated, siloed data, higher premiums, quality of care issues, all of those things. But the industry has shown in the investment of plans investing in a fraud, waste, and abuse software and analytics platform is for every dollar invested in an anti-fraud effort, health plans typically save $10 or more through reduced losses. And that essentially hits the bottom line, ensuring more funds are available and legitimate care is paid for, and quality of care is taking place as well. As well as regulatory compliance, right? Having those ability to report on the expectations that you have. If you're in the Medicaid space, you've got your state SIU reporting that has to take place and such. But then it also then ties back to quality of care and patient safety. FWA isn't just about the money. Many times members and patients are endangered. Fraud schemes provide unnecessary medical procedures, or people are taking prescription drugs that may not be necessary, or they've got, the PBM just continues to mail shipments of drugs and they're stacking up, right? And so you've got meds sitting around in a house and potential safety issues there, or DME equipment that isn't necessary, which really just falls to potential substandard care or just unethical practices. Anything you want to add to that, Ray?
No, I think we can open. I know we're about running out of time here. If there's any questions, fire away.
Absolutely.
Okay.
So I will turn it over to you, Garrett.
Great. Well, actually, I hate to be the bearer of bad news, but we are already a couple minutes over the hour. So unfortunately, I don't think we're going to have any time for audience questions today. However, if you have a question while we are wrapping up here, go ahead and drop it in your question module, and someone will reach out to you via email to answer that. And then, and of course, we'll give you here in a moment the contact information that you can reach out directly. So as we close out, though, first of all, Amanda, Ray, thank you so much. This is a fantastic presentation. Obviously, there's a lot here. There's a lot of information to cover, and I'm sure there is a lot of questions as you think about it more. So happy to answer those. But I'd encourage you all to head over to VBC Exhibit Hall and check out the Covered Bridge virtual exhibit booth there, and you can read up on them and what they're doing in the space, and of course, educate yourself on them if you would like to reach out. And then if you'd like to reach out directly, feel free to do so. Their information is here on this last slide. And where is that last slide? There it is. And you can reach out to Amanda and or Ray here, or feel free to reach out to me. I'm happy to facilitate an introduction as well. But again, thank you all so much for spending your afternoon with us. Hope you have a wonderful rest of your week and a happy holidays, as those are coming up soon. So until next time, thank you so much for joining us. Bye-bye now.
Thank you.
Thank you.